After the flu, 25% of hospitalized patients develop a secondary bacterial pneumonia, and Staph A is one of the top culprits. Why? Because influenza virus strips the respiratory epithelium bare. There's no cilia, there's disrupted barriers, and there's loads of free sialic acid sugars that are just going to be ready for opportunistic invaders. And so, if someone starts to recover from the flu and then crashes with high fever, pleuritic chest pain, and productive cough, immediately you should be thinking of a superinfection. Especially if they're coughing up sputum or have a cavitary lesions on imaging, you should think of Staph aureus, okay? And so don't be fooled by Klebsiella unless they're like aspirating or alcoholic. And CMV, it's only in immunocompromised people. So the key buzzwords here: biphasic illness, sudden worsening, young, healthy patients. It's not another cold, it could be necrotizing pneumonia. Okay, so here's all of our data. Here's all of the information you need. Practice question: we got a 34-year-old man, high fever, pleuritic chest pain, productive cough 3 days afterwards. He's otherwise healthy and unvaccinated. X-ray has a cavitary lesion in the right upper lobe. Which pathogen is responsible? It's Staph A. Post-viral necrotizing pneumonia with cavitary lesions in young patient is classic for your Staph aureus, especially MRSA. This is after another infection, okay? So I want to break this down. Very simple, 3 points to never miss a question like this again. 1, post-influenza pneumonia risk due to altered respiratory epithelium. Influenza leads to damage of the tracheobronchial epithelium, resulting in decreased ciliary function. That's important. So there's an increased risk of secondary infection. 2, secondary bacterial pneumonia. How does that present? Worsening clinical picture: high fevers, productive cough, yellow sputum, pleuritic chest pain, shortness of breath, and that's going to be your secondary bacterial pneumonia. 3, identification of common pathogens in your post-influenza pneumonia. The most common: Staph pneumonia, Staph aureus. Given the age and health status, Staph aureus is going to be relevant because it's severe pneumonia and it's a previously healthy individual. So there we go. That's pretty much it. That's all you need to know for this type of question, so you don't miss another question on superinfections again. And if you guys like this content, if you like how it's free and you want to support democratizing medical school resources out there, then just like and subscribe. It really helps out. So see you in the next video.